And I am so excited to bring in our guest this morning, Silke and Jane Honikman. These are two women that have just been so inspirational to me. Silke has been in this world for 20 years. Jane has been doing parent support for over 40 years. Silke is the founder and the chairwoman of EFCNI. She's joining us today from Germany. And we have Jane, who is joining us from California, and she's actually one of the original founders of Postpartum Support International. And she is also the founder of the Postpartum Action Institute. So without further ado, right in and start with you. And what I want to do is go to our audience, and I want to ask them the same question that I'm going to ask you. So to our audience, when you first started your work in NICU family support, did you think of yourself as a leader? I want to know from you, Jane, because you started your work back in the 70s. Did you consider yourself a born leader, or did you grow into that role?
I did not consider myself a leader. I had little self-confidence. I tagged along with other smart women. They happened to all be women, and we were all new parents, and we found strength together. And leadership came by default. I turned out to be the personality that was appropriately the outreach person. I was the extrovert. And we discovered our strengths by trying to work together and form postpartum education for parents. And that was 1977 when we launched the first warm line in the United States, all volunteers. And we took on different roles, but some people had to go back to work. Some people had to do other things. And Jane said, okay, you can put my phone number up there and I'll be glad to take the mail. And the next thing I knew, I was in leadership role. Right. It's definitely something that evolves, and I did not plan on it. No. Well, our son had problems, our daughter had problems, and all these things are traumatic. But the therapy that came from sharing in this confidential, non-judgmental environment was so important. And that's when we started PEP, and this postpartum education for parents. And 1977, July 1st, I took the first warm line call, and volunteers, trained parent volunteers on that line ever since 1977. And it's still going very well because all parents need support. It doesn't matter what your circumstances are. Something that's always been in the back of my head. This cannot just be about mothers. It has to be about parents. But you'll find that the emphasis is on the one who, has the womb, who lactates. But we discovered that's a little too narrow. And and that takes us to the action part. And that's where I admire you so much, Kira, because all of you who are on this call are involved is because you are not just sitting back, but you're in advocacy.
The very first warm line in the United States for postpartum for support.
In the world. I mean, nobody was going there because what was happening in that decade was just the very beginning of conversation around child abuse and neglect. And they picked up on hotline. And so when we, as new parents, were sitting and saying, we sure could have used support, but we would never have called a hotline because of the stigma. And so stigma is a lot of this that keeps people in their, closet. Emotional support, confidential, non-judgmental, and being at the table. Ask us how we're feeling. Please ask us how we're feeling. And so the professionals didn't have a clue because they're not trained. Right. So we had to learn to do it with each other. And the incredibly important piece of My work has really been understanding at what point can peers have to say to each other as friends and family, I cannot help you anymore. I have a boundary too. I don't know. It's okay. You need to seek professional help. And that's scary. And I'll tell you back to my own story is that there I was suffering from depression that had started postpartum. But there's a family history.
Wow. So, you and Jane and really, NPN, we've all kind of started as parents who had an experience that drove us forward, but we certainly didn't start with, $1 million in the bank and a staff of 30. And, some of our members continue even 20 years later, they are completely volunteer run.
Hospital, whatever it was. So I coined the phrase, a euphemism in English, less than wonderful. Just less than wonderful. And that we need to be there for each other, whatever it is. And as we heal and our babies heal, and I love the fact that your son's in college, my son and daughters have created a huge network. We have 8 grandkids. And so it's beautiful to be able to watch the progress and that we are speaking to truth and being much more honest about our less than wonderfuls.
Still a lot of work to do. And I know, Silke, you have just taken EFCNI to incredible heights. I mean, you are a sought after international organization. You are recognized as a global thought leader and advocate. You have changed policy in Europe. You are the one that started World Prematurity Day. It was not the March of Dimes, for those of you that think it was the March of Dimes. It was Silke and EFCNI. How did you go from, from your first meetings around a kitchen table to partnering with Save the Children and the World Health?
That you never give up and that you are very, very passionate about it, but also patient, because to change a law or to change in the end the mindset of healthcare professionals, of policymakers, of any kind of people you want to address this topic, you have to be patient, because this needs time. That's one very important issue. And you also have to understand that everybody can finally be a change maker. So you have not to be a big politician to really change things. You have to think that every single step you do, it is change. And when we started, and you have to train yourself in being diplomatic, in being a good business woman, men also, of course, but also learn from healthcare professional issues. That means you have to understand, for example, what companies' interests are. What are the doctors' interests? What are the nurses' interests? The gynecologist, the neonatologist. So you have to be somehow a kind of expert. You not need to be a doctor, but you have to understand from what they are talking. And I have learned a lot in legal, in medical legal, in business legal. I have done. Big leader needs to have a lot of knowledge, but also have to be somehow diplomatic to make compromises. And don't think you are not able to do something. You can do a lot of things, and you have to combine forces. So like you here in the network, you need each other, but the others also need you. And with this, I would say, own self-confidence and thinking of we are here as a voice of the babies. We are parents of preemies. 15 million babies are born preterm every year. It's the biggest patient group in the world. So we are not a niche. We are not a small group. We are 15 million people every year. Just count back to the end was the baby born, because we have today's surfactant. When you just calculate the amount of babies born preterm and their families, it is a huge group we are, and we are very powerful. And so therefore we can change laws, we can change system. We just have to combine, and also combine us as a group, as patients.
Oh, absolutely, Silke. Oh my goodness. I mean, I feel like if we were in an in-person auditorium, everyone would be giving you a standing ovation right now, because it's so inspiring, and it's so true. And kind of going back to where we first started in our conversation, where I asked Jane and I asked our audience, when you first started, did you think of yourself as a leader? Most people said no. We had a couple that said yes, but not in this area. And that's exactly what you're talking about, is that when you step into this role, when you decide to start a group, start an organization, write a book, start talking about your experience, you have stepped into creating.
And yes, we've made progress, but now I've taken on a new role in see the population that I see ignored and not included are the men in my field. And the stigma around mental health is really still a big problem. It's certainly better. Certainly a silver lining for COVID is everybody gets it now. We understand stress and anxiety, but when you have a pregnancy and you are depressed, the man can also get depressed. When you have the birth and you have less experiences, even wonderful, and you're not happy or you're anxious to the point of non-functioning, we have got to grasp. So I like the words parental mental health now, because it doesn't use any stigma words with illness. It's around health, but it's parents, it's whatever happens. And the other parting shot I'll give you is that I believe that when we formed our organization in the 70s and called it Postpartum, and it was a word nobody was using, to then have it discover that people are saying defensively, I'm not postpartum, because the connotation was depression, and that's not true. Mm-hmm. And the other is that postpartum isn't over. It is, I'm a grandma. I'm still postpartum because I gave birth. I relinquished a baby. I had miscarriages, all these losses and the things along. You're still vulnerable. You still cry. You still worry because you're a human being. And I think that that's the great rallying cry. I have children in Denmark.
Yeah, well, what I learned is because the one thing is that you have to be patient and being diplomatic to move forward. So in the end, that people not close in the end the door, and then you have it much harder. That is one thing. So for this, because I had to learn this really from the scratch, I did some courses really. I did professional courses in stressful situation, how to react, because I have of course a button in my body who clicks this button and then bang. And this is not helpful when you're in the middle of a panel, or you're in the middle of a discussion, in the middle of a negotiation, and then you have to also handle this button. Because for example, when I had it yesterday still, a doctor wants that we join for a research trial, and he tried 10 minutes to explain me that I'm too stupid because I'm just a patient and I cannot join this research project, and I can join it, but I can only sign the letter that they get the money, but I will anyway not understand. That was a button that pressed quite well, and therefore I exploded, but I exploded not like I would explode 20 years ago. I exploded in a very professional way to tell him that when he wants to work with a patient organization, he has to talk with the patients, not without the patients, and we want to be involved. And if he's not following the rules, then we are so sorry that we cannot join such a research project. But I said this very, very clearly. On the other, this is one thing, so that you are patient, but you're also clear. Because of thinking, well, they think maybe I'm stupid. No, never ever it's stupid. It is their fault when they not write it in a way where you as a normal lay person can understand it. And that is a very important issue. Don't feel you're stupid because you're just a parent. No, you represent the biggest child patient group in the world. And so therefore, be proud of what you are doing, because this is important, and be aware of your role you have, that you in the end can say, yes, sorry, I haven't understood. Can you please explain me to this again? That I can also understand. I'm not the medical doctor. So I'm
What do you want to leave us with?
I just can agree that it's very important what Jane said, to also take care of yourself, because often in our self-help groups or in our groups for other patients we help, I'm also pedagogic, so a preschool teacher, so I always in my life helped other people and forgot totally to help myself, and I got a very severe depression when Lucas was 2 until around 5, because it was there not clear if he would ever be able to walk, and to be diagnosed in the end with a small cerebral palsy. But in the beginning, it looked much bigger. And so I was totally lost in this time frame. And so also in the last years, I always had my family as a backup, my husband and my son and so on. He's going now to university. And but taking care of, there's something what potentially you like to do, but don't forget yourself in helping others, because it is a kind of self-help to help others in this situation we are. That is very important. It's like therapeutic work what we are doing, but we also need, I never have stopped going swimming or dancing, because this is something, it fills up my batteries. And that's something what I really can say, to play in the sand with others. Or my colleague said, yeah, but you have no time, Silke. And I said, when I not have time for this, I'm not a good leader as well, because I never ever should forget where I'm coming from, why I'm doing this. I have to understand what are problems in this situation today, because mine is 23 years ago. And we never have to forget why we are doing this. We are doing this to help others who are now in this situation, and therefore we never have to forget where we are coming from. So to scratch what it is very important to not be in the end Mrs. Marder from EFCNI. I don't want to be this. I'm still a mom who have lost a child, who have still a child. He's going to university, and I'm grateful for this, and would never be there if I would not be in this, or have not been in this situation. And I should be there for them who are now in the situation.
Wonderful. Well, thank you so. Were it not for our sponsors, we would not have Jane and Silke with us. So thank you so much. This has been wonderful. I'm always so inspired when I hear you talk, and I know everybody else has been as well in this possible. So thank you, Jane. Thank you, Silke. I'll see you over in the lounge.